Okay, so blood vessels are the conduits through which the blood is going to be flowing. And we mentioned a very important concept, and that is blood is a fluid. What was the law of fluids that we learned this past Tuesday about fluids? What is so special about fluids? In addition to the fact that we have two types of fluids, we have liquid fluids and we have gas fluids, but both of them have to follow one law. What is it? So there are multiple laws that we have to abide by, but the law that we are concerned with is the pressure. So no fluid, whether gas fluid or liquid fluid, is going to be moving from one place to another, except there is a pressure change, pressure gradient. And the heart, this pump is going to be, the heart is the pump who's going to generate the maximal pressure. So when the ventricles contract, they're going to pump all the blood, and the blood is going to be having the highest pressure at the outlet of the aorta or the pulmonary circulation if we are headed towards the lungs. So the pressure is going to be the highest when you are so close to the pump. And the farther you go away, once you head to the tissue compartment, once you arrive at the tissue compartment, the pressure is going to be so low. So now pressure is going to flow from an area of a very high pressure to an area of a very low pressure. At the lungs, the pressure is also low. That's why the pressure goes from the heart to the lungs. So today we're going to be not looking at the pump. We're going to be looking at the vessels. What kind of vessel do we have? So since this course is anatomy and physiology, since we're going to be doing anatomy, structure, and we're going to be doing physiology, and that's function, we're going to look at the blood vessels. We're going to look at the blood vessels anatomy, and we're going to look at their physiology. Obviously, anatomically speaking, we have two kinds of blood vessels. We have blood vessels that carry oxygenated blood, and we have blood vessels that carry deoxygenated blood. That's the one classification. Functionally, we have blood vessels that carry blood away from the heart, and these are known as arteries. While we have blood vessels that carry blood toward the heart, and these are known as veins. Okay, so we have veins that carry blood towards the heart, and we have arteries that carry blood away from the heart. Some arteries are carrying oxygenated blood, and some arteries are carrying deoxygenated blood. Depends on what are we looking at. So for example, when we look at the heart, we have some blood vessels that carry fresh oxygen-rich blood to the tissue. So that is an example of a blood vessel that's carrying oxygenated blood towards the tissue. So that is going to be away from the heart. So that's an artery. So an artery, this particular artery is carrying oxygen-rich blood away from the heart towards the blood vessels. And we must also understand that the color is very important. What color is a vein? What color is an artery? Well, that depends on what vein are we looking at, because not all the veins are carrying oxygen-rich blood. Not all the veins are carrying oxygen-poor blood. But the law says If you are oxygen rich, you are rich in nutrients, rich in electrolytes, rich in beneficial components, you're gonna be red. So red blood, it means it is blood that is rich in oxygen and rich in nutrients. Blue blood, that is the blood full of waste and toxin, and it is oxygen poor. That's why when there is a laceration, a contusion, or a bruise, or a blunt trauma, what color when somebody gets punched in the eye? Is it a red eye or a blue eye? When somebody gets punched in the eye, what have you ever seen somebody with a punch in the eye? What color is that? It's bluish. Why? Because the blood vessel is ruptured, and the blood vessel has ruptured, so the blood is leaking throughout the tissue, and it's blood that is deoxygenated, so it's bluish in color. Also, you must also understand that if the blood is poor in oxygen, it is not supplying the tissue with oxygen that we need for oxidative phosphorylation, for aerobic respiration, and then the tissue is gonna die. Because if you have a tissue that is waiting by the minute, waiting for oxygen, waiting for nutrients, waiting for electrolytes, for hormones, for neurotransmitters, and they're not arriving there because of some form of a blood clot. So you see sometimes there's an atherosclerotic plaque, a fat plaque, going to be a fat plaque that is reducing the amount of blood that is flowing towards the tissue. So the tissue now is going to suffocate and is going to die. Before the plaque, 100% of the tissue used to get blood. Now, due to this fat atherosclerotic or atherosclerotic plaque, about only 30% of the blood is flowing, so only 30% of the tissue is getting blood, the rest is dying. So that's what leads to cardiac arrest. That's what leads to a stroke. The concept of a stroke and the concept of cardiac arrest, conceptually speaking, are the same. Where you have tissue that is not receiving enough perfusion. The tissue is not receiving enough blood perfusion. So the tissue is now going to die. What tissue is not receiving enough perfusion? If it's the cardiac tissue, then you're going to have cardiac arrest. And if it is the nerve tissue in your brain, the gray matter and the white matter, they're not receiving enough blood, that neuronal tissue is going to die, and that's not a cardiac arrest, that's going to be a stroke. So the names are different because the tissues are different. The heart tissue is different from the nerve tissue. It's the muscle tissue. The brain is a nerve tissue, but the concept is the same. It's a tissue that needs oxygen, but it's not getting it. So it's dying, and that's going to lead to cardiac arrest and a stroke. Okay, so we call the circulatory system. The circulatory system is a system that is going to circulate the blood. And you see here, we have a one big circuit, but it's actually two in one. There are two circuits. The first circuit is the circuit that is dealing with the lung. What do we call that circuit? The circuit that deals with the lung. That's the pulmonary circuit. And then there's another circuit that deals with the tissue, and that is known as the systemic circulation. So you have these two circulations, one circulation heading to the lungs, and that is known as the pulmonary circulation. Then another circulation is heading away from the heart to the tissue and then returning back to the heart, and that is known as the systemic circulation. So both circulation, pulmonary circulation and systemic circulation, one of their components is the heart. The other component is what's going to define what circulation is that. So the pulmonary circulation starts from the heart and goes to the lung, back to the heart. Since it's dealing with the lung, that is the pulmonary circulation. Systemic circulation starting from the heart, going to the tissue, the systemic tissues, then returning back to the heart. That's a systemic circulation. We mentioned that in our physiology, some blood vessels are carrying blood away from the heart. So A for A. Arteries carry blood away from the heart. And veins carry blood back to the heart. Students think that arteries are carrying always oxygenated blood. That is not true. Some arteries are carrying deoxygenated blood. Which ones are those? The arteries that are carrying deoxygenated blood. Who are those? Oh, no, yeah. Yeah, excellent. So these are the pulmonary arteries because they are leaving the heart. Since they are an artery, like I said, A for A, away from the heart, artery. So the artery is carrying blood away from the heart. And since it's deoxygenated, obviously it's heading to the lungs so it can get perfused with oxygen to replenish the oxygen supply. So that's an example of an artery. That's a blue artery. It's not a red artery. But then you have the aorta. The aorta is carrying blood from the heart to the system. What kind of blood do you think we're carrying to the system? Oxygenated blood. Excellent. It makes no sense that we are delivering to our tissue some toxic blood. So that's going to destroy the tissue. So, and you must understand that these two systems, veins, arteries, oxygenated blood vessels, deoxygenated blood vessels, they must have a network. So they must unite at some point. So this is really, really important. I hope the red marker is working since we do dealing with the red circulation. Oh, good enough. Okay. So arteries are going to have a fusion point. Fusion point. Okay, so what do we have here? Well, what is that? This is the tissue compartment. So this is the tissue compartment. So what's happening here? I have a red side of the circulation. So this red side is going to be rich in oxygen. It has a lot of oxygen supply and it has a lot of nutrients headed to the tissue. So once the oxygenated blood reaches the tissue, it needs to get out, right? We need to go out. So the arrow is pointing out. So what's the name of this structure here that allows the blood, oxygen, and nutrients to flow out? There is no flowing out here. So you see this blood vessel does not allow any oxygen or any nutrients to go out. It is only where the holes are found, known as the fenestrations. So this is an artery carrying oxygenated blood. On the other side, you have a vein. You have a vein carrying deoxygenated blood. What would you call this structure here with all the holes that's going to allow things to flow out? That's the capillary. That is the capillary structure. The capillary or the micro circulation. So what's going to happen, the arrow is going to point out. Out from where? From the capillary into where? Into the tissue. In order to give the tissue oxygen, in order to give the tissue nutrients. Now, the problem is, we don't only take oxygen and nutrients, we also make some metabolic waste. So this oxygen that we take, we're going to perform aerobic respiration, oxidative phosphorylation, and then we're going to have, when you order food, you don't just order the food and you keep the garbage in your house forever. You need to be able to, the same way you brought in some food, you have to be able to throw out the garbage. So the same thing, we need to throw away and remove carbon dioxide because that is the main metabolic waste of the oxygen oxidative phosphorylation. We need to throw away all the metabolic waste. So now the arrow is no longer going to be pointing from outside to inside here. On this side, on this other half, the arrow is going to be pointing in. It's going to be pointing inwardly. It's going to be pointing in. Why? Because we want all of this carbon dioxide, all of this waste to flow in and then return back into the heart so it can get pumped into the lungs. This is really important. So you see what's happening now in the capillaries. One side of the capillary is squeezing, like a toothpaste. When you squeeze the toothpaste flows out. But here, this is not toothpaste. This is oxygen and nutrient. Then the tissue is going to be performing metabolism. There's going to be tissue metabolism, and the tissue metabolism is going to generate some metabolic waste and some toxins and some carbon dioxide. That needs to flow back. So what you also need to know is that who's powering this movement? Because we have two different types of movements. We have one movement from the arterial oxygenated blood side of the circulation away from the capillaries into the tissue compartment. And you have another flow from the tissue compartment into the vein. So that's a movement. And we said no movement for fluid except that there is a pressure. So what's the name of the pressure that powers the movement of oxygen from the arterial side into the tissue? That is known as the hydrostatic pressure. The hydrostatic pressure. The hydrostatic pressure. What is the source of the hydrostatic pressure? That is your heart pump. So your heart pump is responsible for this hydrostatic pressure that's going to squeeze out all of the nutrients and the gases into the tissue. Then what about the pressure that's going to power the return of the carbon dioxide and metabolic waste and all of this bluish stuff back into the circulation? What kind of pressure is that? That is definitely not the hydrostatic pressure, because hydrostatic pressure is dealing with the heart. What's the name of this pressure that brings back all the waste into the bluish side of the circulation? It's the osmotic pressure. That is the osmotic, known as the oncotic, osmotic, or colloid pressure. This colloid pressure is going to bring the waste into the venous side of the circulation, and then everything is going to return back into the heart. So these are our arteries, veins, and capillaries. Okay, so now if you look at the blood vessel has three layers. It has an outer layer known as so the three of them are known as the tunics. So the outer layer is known as the tunica externa, because it's on the outside, or the tunica maxima. Then there's a middle layer known as the tunica media. And that is all made up of smooth muscle. The tunica media is made up of smooth muscle. Then you have the tunica interna or the tunica intima. And they call it intima because it's the most intimate with blood. So it's the innermost layer that is touching and being intimate with the blood. So now we're looking at the tunica interna or the tunica intima. Why did they call it the tunica intima? Yeah, because it's intimate with the blood. It's touching the blood. It's intimate with the blood. So it lines the blood vessels from the inside and is exposed to the blood, touching the blood. And the endothelium is actually the blood vessel cells. So these blood vessels are not made from plastic. These blood vessels are not made from tubes. They are actually cells. They are blood vessel cells. That's why when you rupture a blood vessel, a new blood vessel is now going to be made in place of the one that's damaged. And this is known as angiogenesis. Angiogenesis. So genesis is the making, and angio is blood vessel. So when we make new blood vessels, that's known as angiogenesis. Is that clear? Questions? All righty. So that's the tunica interna. Right after the tunica interna, we have the tunica media. That's the middle layer. And what's the hallmark of the tunica media? What did we say that the tunica media is entirely all made up of? What is the tunica media all made up of? Yes. Excellent. It's made up of smooth muscles. So what does that tell you? Smooth muscles are able to contract and relax. So whenever your blood vessel increases in diameter or then decreases in diameter, who's causing this contraction to constrict the blood vessel? Who's causing the relaxation to relax the blood vessel? Which layer is doing that? Yeah, the media, the tunica media, because that's the one that has the smooth muscle. Because the muscle is the only one who can relax and contract. The tunica externa cannot relax. The tunica externa cannot contract. Now that's the tunica externa. That is the outermost layer, and it is made up of just connective tissue to give tensile integrity and structural support for this blood vessel. It consists of loose connective tissue that often merges with neighboring cells. This vasa vasorum is also very important. The vasa vasorum represents small blood vessels that supply blood to the outer part of the larger vessels. What is the vasa vasorum? Vasa vasorum is a network of small blood vessels that enrich and provide oxygen and nutrition to the outer layer, to the tunica externa. So the tunica externa is made up of connective tissue. How many different types of tissue do we have in the blood, in the body? We have the epithelial tissue, connective tissue, nervous tissue, and muscular tissue. Well, if the tunica externa is made up of connective tissue, it's going to ultimately need to have oxygen, is going to ultimately need to have going to need oxygen, is going to need nutrients. So who's going to provide the tunica externa with this oxygen and nutrients and all of that important stuff? It's the vasa vasorum. You're going to see that in the homework. Okay, so that here shows us the histology of the blood vessels. So what do we see here? We see that there are 3 types of blood vessels based on size, There are very large arteries. These are known as the conducting arteries. These are like the highways. You know, once you're on the freeway or the highway or the expressway, that's the conducting artery. An example of that is the aorta. Remember we mentioned the aorta? That's the biggest artery in the body. Then you have the distributing arteries. Distributing arteries are the exit ramps. So if you want to take an exit, so you go off of the big highway into the exit ramp, that's known as the distributing artery. And lastly, you have those little streets that get you to school. So you are first on the highway, then after that, you are on the exit ramp, then you take those little tiny streets that get you to your destination. Blood follows the same law. It's first on the very big, huge vessels on the aorta or the inferior and the superior vena cava. Once it gets closer to the tissue, it takes an exit ramp. So what are the blood vessels that represent an exit ramp? These are known as the distributing arteries. And the blood vessels that finally get the blood into the tissue. So this is the tissue. You see, that tissue is not going to get blood directly from the heart. This tissue, the blood was initially in the conducting arteries, the very big aorta. Then it took an exit ramp and then took a distributing artery. Then after the distributing artery, what happened? The blood is now entering into the arterioles, which are going to help it arrive to the capillary, and from the capillary, we're going to deliver the blood to the tissue. Clear? Questions? Okay, conducting arteries are the biggest arteries. Examples of those are your aortas, common carotid going to the brain, the subclavian, the pulmonary trunk, and the iliac arteries enriching the lower limbs. So these represent what? The conducting arteries. These represent the highways, the very big blood vessels. Distributing arteries, what do they represent? If the conducting arteries represent the highways, what do the distributing arteries represent? Yeah, the exit ramps. And then what do these small resistance arteries represent? Those little streets that finally get you to the capillary so you can exit and enter into the tissue. There we go. So you see here, this is the capillary is divided into two halves, one bluish half and one reddish half. The bluish half is going to have is going to be receiving. So the arteriole, the red side of the circulation is going to point toward, the capillaries, and from the capillary, the red side of the capillary, the blood is going to flow out to the tissue. But the bluish side of the capillary, the arrow is going to be pointing away so that we can leave the capillary with all of our bluish, hypoxic, deoxygenated, toxic blood into the venules. Clear? What's an aneurysm? An aneurysm is a balloon. What's an aneurysm? An aneurysm. So an aneurysm is a very dangerous problem. What happens in the aneurysm is somebody that has high blood pressure. So you remember we discussed there are many concerns with blood vessels. The first concern is that we don't want a blood clot. So the blood clots becomes so thick. We don't want that one. We also mentioned we don't want any occlusion of the blood vessel lumen with any plaque or atherosclerotic or atherosclerotic plaque. Another problem we're gonna be worried about is this concept of an aneurysm. What's an aneurysm? An aneurysm is a balloon that happens because blood is striking the walls. Blood is hitting the wall, striking the wall of the blood vessel so hard due to the high blood pressure. Somebody is always stressed, or somebody has diabetes, or somebody has hypertension, someone that has atherosclerosis. The blood is hitting the wall. What do you think is going to happen when the blood hits the wall? The wall is gonna have a defect and it's gonna bulge out like that. So blood is now going to enter into this region and it's going to stay there. And with time, the blood is gonna clot inside this balloon here. This is the aneurysm. This balloon full, this sac or balloon full of blood. Then after a while, what's going to happen to the aneurysm? It's going to rupture and blood is going to leak out. And that's an example of what kind of hemorrhage? Internal hemorrhage or external hemorrhage? That's an internal hemorrhage because the blood vessel is inside your brain, inside your body. And then it ruptured and blood is leaking internally. So does everybody understand what an aneurysm is? Okay. It's a weak point in an artery or a heart wall, and it forms a thick-walled, bulging sac that pulsates with each heartbeat. Now, we are very concerned with blood pressure. So we want U tension. We want U tension. That is what we're looking for. We do not want hypertension, and we do not want hypotension. So hypotension, there is a drop in blood perfusion. So the blood is not arriving to the tissue, while in hypertension, the blood is rushing so rapidly and hitting the walls, and that may lead to hemorrhage, that may lead to aneurysm, that may lead to kidney damage. You know, patients that have hypertension, the blood is flowing so fast to the kidney, it's going to even cause a damage to the kidney. So in order to keep this blood tension, if we want to achieve hypotension, we need a system of sense. We need to sense if the blood pressure drops, so we don't die, and we need to sense if the blood pressure increases, and we need to fix both. We need to fix hypertension and restore it back to eutension, and we need to fix hypotension and restore it back to eutension. So let's look at both systems. See, always we're dealing with two systems. We don't want hypercalcemia, we don't want hypocalcemia, we want eucalcemia. We don't want hypervolemia or hypovolemia, we want euvolemia. We don't want hyperthermia, too hot, or hypothermia, too cold. We want euthermia, that is the proper right temperature. So now let's look at these sense organs. So there are sensory structures in the wall of the major blood vessels. These sensory structures in the walls of the blood vessels. So these are my blood vessels. I have some sensory structures. What do you think these sensory structures detect all the time when they are found around your blood vessel? They measure how hard is blood pumping against the walls of the blood vessels. So if the blood is pumping so high, so hard around the blood vessel, these receptors are going to send information to the brain. Hey, brain, blood is hitting the walls too hard. That means this is hypertension. We need to cool things down a little bit. And the opposite too. If the blood is not hitting the walls as usually as it should, say, hey, something is wrong. Blood is not flowing as it should. So we need to report both problems. So these sensory organs are very important. The baroreceptors detect stretch of the blood vessels. Now, the baroreceptors are important because they sense what? The stretch of the blood vessels means that we have hyper or hypotension. If blood vessels are stretching, does that mean the blood pressure is high or low? It's really high because it's pulling the diameter, it's stretching the blood vessel diameter. So now that sounds like a problem. So now the baroreceptors are gonna say, brain, help us. We're gonna end up with an aneurysm. We're gonna end up with a hemorrhage. So we need quick intervention. So now the brain is gonna send out an output to the heart and say, lower the heart rate, bring down the heart rate. You see, it keeps happening again. Remember that diagram that we began? Remember when we began the course with a receptor? Okay, so remember we said receptor that's gonna send in an input signal to a control center, and then an output signal is going to be generated. So in the case of the heart, what kind of receptor is going to be sensing the stretch? That is known as the mechanoreceptor, but it has a specific name. Excellent, mechanoreceptor, but the specific name is the baroreceptor. So the baroreceptor is going to be sending an input signal, and we said input signals are always what? Sensory. And input signals that are always sensory are carried by what airlines? What kind of neurons? Afferent neurons. So we utilize afferent neurons who are going to tell now who's going to be our central nervous system integrating center? That's going to be your brain. Where exactly? The hypothalamus. So the hypothalamus is going to receive input. Hey, hypothalamus, blood pressure is so high. But the hypothalamus is going to send out an output that is what? An output is always motor. And what airline carries that? What kind of neuron carries that? Efferent. Excellent. So this efferent neuron is going to go now to the heart and says to the heart, oh, heart, you're the cause of all of this. Because had you not been pumping so high, the blood pressure wouldn't be so high. So we need to do what? Heart rate. Please bring down the heart rate. Please bring down the blood pressure, BP. Please bring down the contractility. Do not contract as fast as you are. Bring down the contractility, bring down the blood pressure, bring down the heart rate. And doesn't that repair the problem? That repairs the problem that the baroreceptor detected, because the brain told the heart to lower the blood pressure and the heart rate. Okay, there are other receptors also. Chemoreceptors. Why would we need chemoreceptors in the blood vessels? What are chemoreceptors doing? You know when you taste the soup, it's too salty, it's too sweet. That's exactly what they're doing. They're tasting your blood. They're tasting your blood for what? Yeah, so what kind of changes? pH, acidic or basic. So we're not only concerned with whether blood is going so fast and pressure or not, we're always also concerned with what kind of blood is that? Is it too sour? Is the pH too low? Is that acidosis? Or is this alkalosis? So they are the ones who are going to be tasting your blood. These are the chemoreceptors. So they monitor, if you see where my mouse is, they monitor the blood chemistry and they adjust the respiratory rate. So if you have so much acid, you're going to end up peeing a lot of acid. Your urine is going to be because you know your excretory system is important for removing acid. If your blood is full of acid, your kidney is going to start shunting and taking acid from your blood into the urine to reduce it because you have too much acid in your blood. What about your respiratory system? Also, your respiratory system is going to say, oh, there's so much acid in the blood. So let me increase the rate of hyperventilation. So you're going to end up going like this. And that's exactly what happens when you're running the marathon or when you are on the treadmill. Why do you go like that? You're hyperventilating because your body is full of acids and you're going to need to remove this acid. So you remove it utilizing your respiratory system. And you also, after you get off the treadmill, you realize that you want to go use the bathroom. So you can urinate and remove the acid that built up. Where did the acid come from when you're running? Where did it come from? Did you eat something acidic while you were running? Did you eat something acidic while you were running? So what led this acid to build up to the point where you need to increase the respiratory rate and you need to urinate severely? What caused that? It's when you're running so fast, the metabolic demand is so high that oxidative phosphorylation, aerobic respiration is not sufficient. It's getting us by, but it's not sufficient. We need an extra source of energy. So we rely on anaerobic respiration now. So we have both happening at the same time, aerobic respiration and anaerobic respiration. The problem with anaerobic respiration is it builds up lactic acid. So now anaerobic respiration is helping you to survive, but the byproduct is really bad, which is the lactic acid. So you have so much lactic acid building up in your tissues, so you need to remove them by increasing the rate for breathing. Who told your brain to increase the rate of breathing? That there's so much acid in the blood. Who told the brain that? The chemoreceptors. Excellent. They are tasting the blood. Say, oh, blood, this person is running on the marathon. The blood there's so much lactic acid. Can you please increase the rate of, because only your brain can increase the rate of breathing. Rate of breathing does not happen on its own. Your brain needs to increase the rate of breathing. But the brain needs to be told. Somebody needs to tell it that. It's your chemoreceptors. Same thing, your kidneys. Who's going to tell the kidneys to remove the acidic substance in the blood? It's also the receptors, chemoreceptors in the kidney. The blood that is being filtered in the kidney is constantly being tasted. Oh, this blood is too acidic. What about the opposite? What if now, instead of having too much acid in your blood, you have too little acid? Is that okay? Is that okay having too little acid? We're not supposed to have too much of anything or too little of anything. We're supposed to have a normal range. So if you had too much acidity, you breathe, hyperventilate. If your acidity is too low, what happens now? It's not that hard. If your acidity is high, you hyperventilate to get carbon dioxide out. But what if the opposite? You're not having a lot of acid. Your acid is dropping. Your base, you're having alkalosis. So how can you save that? Yes. Exactly. That's called hypoventilation. So now you're gonna stop breathing as fast. Why? Because you want to build up carbon dioxide. You don't want to lose it. Why do you want to build up carbon dioxide? Because carbon dioxide gets converted into carbonic acid. And this carbonic acid, we want it now. We want to increase the acidity. So we don't want one or the other. We don't want too much acid or too much base. We want the normal amount. But in the end, we're never going to find out unless the chemoreceptors tell us. So we need chemoreceptors, we need baroreceptors. So these blood vessels are not ignored and they're not living marginalized. There are baroreceptors measuring their constant distension Are they distending excessively? That means there's high blood pressure. Are they not being distended excessively? It means the blood pressure is now dropping too low. Maybe the person is dehydrated, he's gonna have a syncope, he's gonna faint. That's very dangerous. Or the patient is gonna have a shock. So people who faint, why do the people faint? Why does somebody faint? Because of the blood pressure is so low. It's not getting to the brain. Remember we said in the brain, the cortex is a visual cortex, somatosensory cortex, hearing cortex, and balance cortex. That cortex is made of cells. So if your blood pressure is so weak and your heart is not pumping hard enough, the blood is not getting to the brain, these centers are not receiving oxygen, they're not going to work. So you're going to fall. So hypotension leads to shock. Hypertension leads to hemorrhage. Any questions? So where are they found? So this slide here is showing you where are they found. You have baroreceptors in your aorta, and you have chemoreceptors that are on the external carotid artery and the carotid sinuses. So these are baroreceptors on the carotid sinuses, and there are baroreceptors on the aorta. Capillaries, these are the exchange vessels. We describe them. These are the ones that have holes that allow for the exit of oxygen and beneficial nutrition, and they allow for the uptake of all of the substance that needs to be returned back to the right heart. These parasites, it's very important to know these parasites. You know, people who have diabetes. Why is diabetes dangerous? Because sugar is building up. There's so much sugar in the body. We discussed last time that when you have so much sugar in your blood, it's going to end up latching and attaching where? Red blood cells. Excellent. Is sugar only going to be attaching to red blood cells? What about the kidney? Is the sugar going to be attached to all your kidney, nephron, destroying them? Imagine you pouring glue that is made up of sugar on top of your kidney cell. That's going to cause kidney failure. What about the people who have diabetes? What happens to the nerves or of their toes? Yeah. Exactly. Why is that? Because the sugar is so dumped. There's so much sugar dumping in the nerves of their toes and in their tissues that's going to cause nerve damage. What about the healing? If somebody who has diabetes gets cut, is the sugar going to allow the cells to heal, or is it going to delay the healing process? It's going to delay it really badly. Their wounds don't heal. It takes them forever to heal because so much sugar. So parasites, what are they? Parasites are capillaries in your eyes. In your eyes. When there's so much sugar in your blood, they blow up inside your eye. So when they take an ophthalmoscope and look into your retina, what are they going to see? Splashes of blood. Where does splashes of blood come from? Capillary. Yeah, the capillary has blew up, ruptured, exploded. Why did the blood vessel of the capillaries in the parasites around your eye? Where are the parasites found? Where in your body can you find parasites? In your eyes. So that's why when you do an ophthalmoscope, like we said, you look into the eye of a diabetic patient, you see red splashes because parasites are constantly blowing up, exploding because of the sugar is dumping on their walls and rupturing them. And so diabetes is really bad. It's really terrible bad. So be careful with your sugar intake. Yeah, diabetes is very bad. When we do the reproductive, it causes even infertility, latching on the sperms, destroying the sperms, destroying the eggs for females in the female reproductive. So It's very bad, this diabetes. What are these? Parasites that are found around the eyes. Okay. What did we mention last week, 2 days ago, about the sinusoids? What are these sinusoids? Sinusoids are blood-filled sacs. And we said some sinusoids are like a camp that tests the red blood cell. If the red blood cell is really young, it can maneuver through the sinusoid. If it's really old, what's going to happen? It's going to get trapped and get killed there. Where is that place? Where red blood cells are being tested for their durability and their youth. How young are they? How are they able to maneuver through the sinusoids? And if they are young enough, they pass through. If they are old, they get trapped and destroyed by macrophages. Where is that? Not the kidneys. We said the graveyard of the red blood cells is the spleen. Excellent. The spleen. Very good. So the capillary beds are networks of 10 to 100 capillaries. They are usually supplied by a single arteriole or a meta-arteriole. So within the capillary bed, there are precapillary sphincters. So the sphincters relax or tighten up. If you need blood to pass through, what's going to happen to the sphincter is going to relax. If you need less blood, the sphincter is going to tighten up. So there you go. There are sphincters here. You see where my mouse is? So if we want blood to come in, we relax the sphincter, the blood goes in. We want blood to go out, we relax the sphincter for blood to go out. If this type of tissue does not need blood, the sphincter is going to tighten up. Why would we need something like that? Yes, we need to increase blood pressure because you see this slide here. Yeah, this one. Please look at this slide. This is a person resting and watching TV, and that's a person running. Do you think the blood goes to all parts of the body equally, or does it depend on what you're doing? So if you're running the marathon or exercising like these guys, where do you think blood is going? To your skeletal muscles, to your legs. And if you're eating, where do you think blood is going? To your intestine. So let's look at these two people. I am sitting on the weekend having a meal, watching TV. Alec is running on the weekend the marathon. Both of us have blood, but my blood is going to my intestine because I'm eating something. While his blood, if he's not eating anything, his blood is going mostly to his skeletal muscles to run. That's how the sphincters work. So if you need blood to go to your intestine, the sphincter by the intestine is going to relax to allow blood to go to the intestine, and the sphincter near your skeletal muscle is going to contract to prevent blood from going to the skeletal muscle because you don't need blood near skeletal muscle. But if I start running and you go and sit down and have a meal, then the opposite is going to work. The sphincters of your digestive system are going to relax so they can help you digest the meal. And the sphincters around the muscles of my legs, because I'm now running, are going to relax and more blood is going to flow. Do you understand how sphincters work? Sphincters are used to tightly regulate where should blood go. Blood is not flowing uniformly, equally throughout all your or your body tissue. Some regions get more blood than others. So there is discrimination. There is no equality of blood. If you're running, your skeletal muscles will get more blood. And if you're eating, or if you take an exam, your brain is going to get more blood because you're thinking. But if you're running, your brain is not going to get a lot of blood. Your skeletal muscles are going to get a lot of blood. So there is a inequality based on the demand. Who demands more blood? Does my skeletal tissue demand more blood? Does my digestive system want more blood? We give whoever needs blood the most in order to survive, utilizing the sphincters. So now we see how sphincters work. Okay. Okay. Vessel veins. This figure is really important. What does this figure show you? It shows you that 64% of blood at any time is found where? In your veins. That's why we call them the capacitance vessels. We call them the capacitance vessels. So they are like a toothpaste. If you get hemorrhage, God forbid, if you start losing blood, before the ambulance get there to pick you up, and before they give you blood transfusion, what happens? Your veins, this 64%, is gonna squeeze to give you blood until the ambulance gets there. So you have a ambulance before the ambulance gets there. You have a first aid, you have a built-in system of survival even before the ambulance get there to help you. So you squeeze the blood, and that's going to cause an enrichment of blood flow from the veins. That's why we call them the capacitance vessels. Who are the capacitance vessels of the body? Who are they? The veins. And the same way we said we have a distributing artery, and we have a conducting artery, and we have resistance arterioles, the same way the size of the veins progressively increase. The smallest ones are right next to the capillary. Then you have the distributing artery, the distributing veins, then you have the conducting veins. What are varicose veins? This is very important to understand. Varicose veins are disease that happen to pregnant women, obese people, and people who have an occupational hazard. People who stand all the time, like the traffic police, like nurses, like teachers. If you're standing on your legs all the time, what happens? What happens is, the blood, when it gets to your foot, it needs to, so the blood goes down to your foot. Now it needs to go up. So we need to have valves that are one direction. So valves that allow for blood to flow in one direction up to my heart. Due to pregnancy, due to obesity, and due to the occupational stress of having to stand for too long, what happens to these valves? Have you ever seen the doors that open both directions? Yeah, those exist. I thought they were cool. But anyways, they open in both directions. This valve is not supposed to open in one direction. Blood is supposed to go up. Is blood supposed to reflux back? But for those people who have pregnancy and obesity and occupational damage, the valve is destroyed. So now blood goes up and reflux back. Goes up and start to pool. So there is blood pooling. There is blood pooling. So the blood is going to pool and it's going to fall back. Blood is pooling and falling back and building up in the bottom of the foot. So you see that the people who have varicose vein, there is a lot of engorgement and blood pooling. So the blood pools in the lower legs of people who stand for long periods of time. Hemorrhoids or varicose veins of the anal canal, and that is due to the trauma of the constipation. Okay, that causes a lot of trauma to the blood vessels that are surrounding the rectal canal. Okay. The simplest and most common route of blood is from the heart. We discussed that. The pump, the heart, arteries, arterioles, capillaries, venules, veins. Can somebody put in order where will I have the highest pressure? Where will I have the second highest pressure? And so on. Where is the highest pressure here? Kayla. The highest pressure is in the heart. Then we descend the arteries, then the arterioles. That's what leads to the movement. If the pressure wasn't highest in the heart, it's not going to be pumped. Then if it wasn't highest in the arteries, then it will go next to the arteries, then like a domino effect, then into the arterioles, then the capillaries, then the venules, and then lastly the veins. This is an interesting figure, and it's showing you that not all the time you're going to have that in this way. You're not always going to have all over the body artery, arterial side of the circulation, venous side of the circulation, vein. Sometimes this is what we traditionally have. That's known as the simple pathway. Red side of the circulation, blue side of the circulation. Sometimes you can have double circulation before you get back to the heart. Isn't that interesting? It's like you go to airports before you go to your final destination. Sometimes you go from New York to the California airport, then back to New York. Sometimes you go to New York, California, Texas, then back to New York. If you go to two airports, if you go to two capillaries, that is now called what? Portal system. That's a portal system. Where did we hear of the portal system before? The hypophyseal portal system. Where was that? Excellent. From the hypothalamus to the posterior pituitary, there's a portal system like that. You will see when we do the liver, there's another portal system. Excellent. You're doing. I'm going to give you extra credit. Very good. Keep it up. Arteriovenous anastomosis. What is that? Arteriovenous anastomosis is when you skip. So it's very interesting. Sometimes you can have a circulation where you don't even pass through a capillary system. Do you notice that? So we don't only have to go from red into blue through a capillary. Sometimes we can skip a capillary. What do we call that? Sometimes people don't go to New York, California by airplane. They just drive on the highway, like here. So what do we call that? When they fuse, it's like a fusion. You see the fusion? They fuse into each other. What do we call that? A shunt. And arteriovenous, because it's from the artery to the vein. Arteriovenous shunt. A shunt happens when we don't go through any capillary. And that's another type of, so an anastomosis is when you have a fusion. So you can have an arterial anastomosis, and that's when you have multiple arteries fusing together. That's a venous anastomosis, is when multiple veins fuse together. But once an artery and a vein fuse together, what kind of, in the end of the day, it's an anastomosis. Anastomosis is when you have blood vessels fusing together. If they are all arteries fusing together, we call it arterial anastomosis. If they're all veins fusing together, we call that venous anastomosis. If there are arteries fusing into veins, we call it arteriovenous anastomosis, like a hybrid, like a 2-in-1. One side is artery, one side is vein, fusion, like a hybrid. You know the hybrid car? The hybrid car is electric and gas. Electric and gas. Anybody has a hybrid car? You do? How are those?
Okay.
They're good?
Only fill up gas like once every 2 weeks.
Oh wow, I gotta get one of those. Interesting. I got to learn about these hybrid cars this past week. I had no idea about them. I heard of them, but I didn't know how they work. But now they sound very interesting. Oh wow, very nice. What's a portal system? Derek. Excellent. When blood flows through two capillary networks before. Exactly. Now your definition is complete. Excellent. Is when your blood is flowing through two capillary circulation before going back to the heart. Very good. Very good. Very good. Very good. Very good. Okay. We talked about the hypophyseal portal tract, and this is the hepatic portal tract also. So from the liver, so going into the liver, because the liver is so helpful. The liver makes the albumins, the liver makes the globulins, the liver makes the fibrinogen, the liver makes bile. So we need to sometimes make an extra trip into the liver. So we need a portal system for that. You see, the hepatic portal circulation travels from the intestine of the digestive tract to the liver. Okay. What's the difference between blood flow and perfusion? Blood flow is how many is volume per unit time. So blood flow is volume per unit time. Like how many milliliters of blood are flowing in 1 minute. That's flow. Perfusion is interesting. Perfusion is how much volume of blood is flowing per unit time into how much mass, grams of tissue. So if I say 75 grams of brain tissue is receiving 25 milliliters of blood every half a second, that's perfusion. Because I looked at 3 dimensions: the mass, the volume, and the time. That's perfusion. But when I'm only looking at the liters or the volume per unit time, that's known as the blood flow. That's just flow. This is really important. So this is showing you that the flow rate is, what does this sign represent when you see that? That looks like a alpha sign. What does that represent? It means that the blood flow is proportional to. So what does that mean? That means the pressure. Okay. Okay, blood flow is directly proportional to change in pressure over the resistance. So that means my blood flow is gonna increase the bigger the change in pressure. That means if there is a 75 millimeters of mercury compared to 750, compared to 7,500 millimeters of mercury, the more I increase the pressure gradient, what happens to the blood flow? Increases because it's in the numerator, it's not in the denominator. But why did they put the resistance in the denominator? Because it is the opposite. Meaning, if the resistance increases, what happens to the flow rate? Decreases. And if the resistance decreases, what happens to the flow rate? Increases. So give me an example of what makes the blood vessel resistance increase. Give me one example of one thing that if it happens, you know the blood vessel resistance. So from the name, resistance to blood flow. What could be a cause for resisting blood flow? So when you're running, your heart is pumping blood harder. But what could be within your blood vessel? So think of it this way. Assume that you are blood flowing inside a blood vessel. What can make you go slower in the blood vessel? Blood clotting, excellent. So the viscosity, very good. The viscosity increases blood resistance. Blood is so thick. So the resistance is so high because blood is so thick. One more question, I give you extra credit. Give me a reason to make the blood vessel viscosity go high. Like this blood clotting. Why is the blood clotting? What makes, like, let's say they take blood sample from me and from you, and my blood is going to, not the blood type. What makes my blood thick and viscous like honey? What could make it happen that way? Yeah. So if you know, last month my blood is flowing so smoothly. They take another blood sample, my blood is not soft, thin anymore. It's so thick. What could make my blood thick? We talked about that last time. Correlate. What makes the blood of somebody? What are the things that if you do them, your blood is gonna be thick like honey, like jelly? Yeah, so what makes it thick? Like what causes the platelet to thicken up the blood? Delaney. Okay, you see, you still have an answer. What is it? Okay, Delaney. Anybody? Yeah, exactly. If you're a smoker, remember we said last week, if you're smoking cigarette, the nicotine is gonna stick up all of the blood vessels. And we said that pediatric patients, 18, juvenile pediatrics, 16, 17, 15, they come in the doctor's office and their blood is getting so thick because of the nicotine. Yeah. So some medications, if you take them excessively, like usually we give medication that thicken up the blood to patients who suffer from a hemorrhage, an internal hemorrhage or external hemorrhage, because we don't want the blood to flow thin and just run out, leak endlessly. So if we give them now excessive amount of that, the medication is definitely gonna thicken up the blood. Some other medications that are intended to treat some disease, they can have a side effect of thicken up the blood also. That's true also. Question? Any questions? Okay. So besides smoking and blood viscosity making the resistance go high, what else can make the blood resistance go high. That is not blood clotting. Dehydration increases the blood viscosity. Excellent. Dehydration makes your blood thicken up because now there's less water. So it tends to stick up, just like smoking. So smoking and dehydration make your blood really thick. Now, give me another thing besides viscosity that could make your resistance high to blood flow inside the blood vessel. Yeah. So blood cancer is like when you have polycythemia vera, you have excessive amount of red blood cells being made. That thickens up the blood also. Excellent. But this is all is falling into one thing. You guys always giving me examples of viscosity, of blood viscosity. Too much smoking makes the blood too thick. Too dehydrated makes the blood too thick. Red blood cell cancer, polycythemia vera makes the blood too thick. That's viscosity. I don't want viscosity anymore. I want something that is not viscosity, but still gonna make your blood resistance high. Yeah. So high blood pressure is going to high blood pressure. Is high blood pressure going to increase the resistance? So high blood pressure is going to cause an injury that's going to ultimately lead to the the resistance causes high blood pressure. Resistance terminally causes high blood pressure because you want to overcome it. You understand me? If somebody is a smoker, their blood pressure is always high. Why? Because the blood is trying to pump this really thick blood. If you're dehydrated, your blood pressure is going to go up. So blood pressure, high blood pressure is a result of the blood being too thick. So if your blood is too thick, you're always going to have high blood pressure. But what is a reason for resistance? Resistance, yes. So vasoconstriction is, yeah, so tightening, so you're heading in the right direction. Tightening the blood vessel is going to make the blood pressure high. What is something that could tighten my blood? How about atherosclerosis? How about when there's so much fat building up inside the blood vessel? That's going to make the blood vessel smaller. So if this is my blood vessel, like that, and I have fat, and the fat is going to make the lumen of my blood vessel smaller. So that's going to increase the resistance. The last thing that's going to increase resistance is the length of the blood vessel. Imagine you got a blood vessel this long compared to a blood vessel this long. Blood is flowing through blood vessel A, and blood is flowing through blood vessel B. Which one is finding more resistance? It's B. So the longer the blood vessel, the longer the resistance. Blood pressure is read in two values, a numerator and a denominator. Systolic blood pressure is representing the blood pressure of pumping. And diastolic blood pressure is the pressure of relaxation. This lecture actually is not a very conceptual lecture, very few concepts. There's a lot of vessels to memorize. That's why if you look at the homework for the lab practical, there's many different vessels that you need to know. The carotid, you need to know your carotid artery, you need to know your brachiocephalic trunk. So you're going to be spending more time on this lab practical than the one you did last week. So please make sure that you go over all the photos. You go over all the photos and you know them really well. So this lecture, we're going to see the main concepts and, blood pressure. We talked about hypertension. Hypertension is diagnosed when you have 140 over 90 or above. Blood pressure that's 140 over 90 or above. And hypotension is when you have chronic low resting blood pressure. This formula is very important. Cardiac output. cardiac output is represented by your heart rate multiplied by your, what does SV stand for? SV stands for stroke volume. You have your hand up? Sorry, stroke volume. So if you have somebody who is suffering from high blood pressure, what do you think is the medication going to target? Those two, the heart rate and the stroke volume. So how is that? If a patient has high blood pressure, you're going to give them calcium channel blockers. Calcium channel blockers, because you know you need calcium for the cardiac muscle action potential. If there's no calcium, is your heart going to contract? So the contraction rate is going to slow down, and then the blood pressure is going to go down. So here you treated high blood pressure by affecting the heart rate by calcium blockage, calcium channel blockers like amlodipine or Norvasc. What about stroke volume? How could you affect stroke volume? How could you affect stroke volume when you want to treat a patient who has high blood pressure? Now, you know this one, I give you extra credit. This one wants you to be a really good thinker. So if you wanna, let's say a patient that has high blood pressure, you can either give them a medication that lowers the heart rate, like the calcium channel blocker, is gonna prevent calcium from binding to heart cells and stop the action potential and lower the heart rate. What if another patient cannot handle that kind of medication? You need to repair the high blood pressure by affecting the stroke volume. So what do you think you need to do to the stroke volume? Increase it? Because look at the formula. Cardiac output equals heart rate times stroke volume. If you increase heart rate, what happens to the cardiac output? If you increase heart rate, what happens to the cardiac output? It goes up. If you increase heart rate, cardiac output goes up. If you decrease heart rate, what happens to cardiac output? It goes down. So that's why the patient who has high blood pressure, you give them amlodipine, calcium channel blockers, they lower the heart rate and the blood pressure drop because of the cardiac output drop. What about stroke volume? If a patient has high blood pressure, do you want to increase the stroke volume or you want to decrease the stroke volume? You want to decrease stroke volume. What can you do that's going to decrease stroke volume? That one wants you to be a good thinker. What can you do to make the stroke volume drop?
Opioid.
Opioid is for pain. It's for pain. Stopping the signal of pain transmission. How about urination? So you had a blood volume and you give the patient a diuretic pill and they start peeing and peeing and peeing and peeing. What happens to their blood volume plasma? Because your plasma has a lot of water. So are they peeing a lot? What happens to the water? In the plasma drops. So when the water drops, what happens? So it's like they're being dehydrated. That's why dehydrated people, are they gonna have high blood pressure or low blood pressure? Low blood pressure. So you make them urinate, they lose a lot of water, their stroke volume is now gonna drop. And actually, diuresis is faster in bringing down blood pressure than anything else. Because you're just peeing the water out, you're reducing blood pressure, and you're removing the edema. Remember the pitting edema? The pitting edema? The edema, the swollen, engorged legs, that if you put your thumb into the swollen legs of a patient with lower limb edema, it makes a pit, it makes a depression. So we give them this diuretic so they can pee out all the water, remove it. So then the pit is not going to be there anymore, or it's not going to be as deep as it was. Clear? Okay. We talked about that. Blood viscosity increases resistance, blood vessel length increases resistance, and the radius. That's why we said atherosclerosis causes high blood pressure, because there is so much fat inside the blood vessel, it makes the blood vessel diameter become very small. Okay. Angiogenesis, we talked about that, and that is the birth and the making of new cells. Okay, I had a video on my YouTube. We discussed this, the blood pressure feedback mechanism. And chemoreflex, we discussed that. Remember that? The chemoreflex, when there's tasting of the blood, does it have too much acid? Does it have too little acid? Okay. Okay. And this, we discussed this concept that who can explain this figure for me? What's happening in this figure? Nicole is going to explain to us what's happening in this figure. So take your time. Look, there's two things happening. So you're going to be describing two things. What are the two things? A and B. So we see in this figure that blood is not distributed evenly all the time. It depends on the demand. If you're eating and resting, your digestive system is demanding more oxygen and blood so it can digest the food that you're eating. So the sphincters are going to dilate next to your digestive system. But if you're running, you're not using anything in your digestive system. That's all your muscular system, and all the blood is going to flow into the muscles. Clear? Okay, we did the capillaries. Okay. We discussed edema, and we said we treat edema by the diuretics. So this is the varicose vein. You see that the skeletal muscles contract and they help propel the blood upward. But for people that have a damage to the vessels, the blood is to the valves, blood is going to be flowing backward. Okay, circulatory shock. Okay. Talked about shocks. Skeletal muscles. Okay. So this here is showing you the different types of blood vessels. These are the major blood vessels. You only need to know the ones that are on the figures. So don't go around memorizing all of these little tiny blood vessels. Just make sure you know the major ones. You know, you have to know your aorta, your aortic arch, and you have to know the iliacs, and you have to know the abdominal aorta. So just the ones that I have given you in the in the um in the homework. Any questions? Okay. Um, there's a video that I had here on my channel. I'm gonna end with this video. Angiogenesis. There we go. Angiogenesis or blood vessel sprouting.
Our topic for today, and that is angiogenesis. Angiogenesis.
Can you guys hear?
Hello, and welcome to our topic for today, and that is angiogenesis. 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 A very important topic that does not get the due justice.
Okay, so you can watch this at home.
Parameter is tumor.
This is showing you
progression.
that,
There is no.
and so just to summarize really quickly, if a blood vessel is damaged, the nearby blood vessel is going to be sending a cytokine, and the cytokine is going to start to make a tunnel. You see, we went from nothing in common between these two blood vessels, 1 and 2, and now there is a third blood vessel. You see where my mouse is? Allowing for blood to pass through from this blood vessel into there. So that's known as a collateral circulation or an elongation of the blood vessel. Why would we need something like that? Why would we need this extra passage site? It's because maybe there is an occluded blood vessel. Let's say blood vessel is like this. And then there's an occlusion here due to like a fat plaque, like an atherosclerosis. Atherosclerosis here. So what happens is, to bypass this point, there's going to be angiogenesis here, and blood now, instead of, because it cannot go through here anymore. So now it's going to pass through this direction. Is that clear? Known as a collateral circulation. If there's like a traffic accident on the highway, don't you take like another side road so you can go across where there's like a congestion? So here there's a congestion here, or there is a particular type of a fat plaque or a blood clot. We avoid it. We make an actual blood vessel. Also the tumor. If the tumor wants to grow, the cancer wants blood. Cancer wants oxygen. So the cancer cell will start to make blood vessels passing, start to make angiogenesis, start to sprout. So angiogenesis is the sprouting. Angiogenesis is the sprouting of blood vessels. Are we clear? Clear. Any questions? Okay, exam Monday and Tuesday lab practical. So please make sure that you do excellent. Let me take the attendance.